struggles with the public health care system. And following Cody, we'll have Brandon Shapika from Ontario. And he'll be speaking on stereotypes and gender issues. And following Brandon is Kelly Dion from Quebec. And she'll be talking about job and education considerations. And we'll be concluding with Alan Kennedy from Nova Scotia. We'll be talking about the nursing shortage. And I'm Susan Stapel, your national team coordinator this year. Woo! To keep things a little interesting, we're going to conclude the presentation with some unique trivia questions. So be the first to raise your hand, and we'll see if you get the answer right, and then you'll win a prize. So now I'll turn it over to Jenna. Thanks.
Good afternoon, everyone. My name is Jenna. I'm a fourth-year nursing student from Vancouver Island University. Today I'm also representing the Western region as a member of the national team. Today I'm going to be talking about the Canada Health Act and its implications in our currently two-tiered healthcare system. Because as much as we want to deny it, we are currently a two-tiered system. So I'll begin with a brief history and then finish with some potential solutions to our problems. So life before Medicare. Canada actually used to be a part of a for-profit healthcare system. It was privately run, but it was so unpopular that with hard work and a strong vision from a small group of people, it was replaced with Medicare. This was a tough lesson learned for Canadians, but I believe that we, the next generation of nurses, have the chance to show if we have truly learned from it. So the Canada Health Act is a very important, powerful piece of legislation passed in House of Commons in 1984 with the help of organised nursing and other groups such as the Canadian Healthcare Coalition. The main point of the Canada Health Act was to provide guidelines for provinces and territories to follow in order to receive federal healthcare funds. There's 5 main points in the Canada Health Act. The first is public administration. This means that all insurable healthcare services must be provided publicly in a not-for-profit manner. The second is comprehensiveness. And number 3 is universality. This is important because it means that every Canadian citizen must be 100% covered for insurable services. Number 4 is portability. But the most important point in my presentation is accessibility. This is the most important because it is the most frequently violated by privatization. Accessibility means that every Canadian citizen must be guaranteed access to all insurable healthcare services unprecluded by financial status. No Canadian citizen is left behind according to the Canada Health Act. So these points are wonderful. They're great, they're so clear, and they seem so straightforward. So what's the problem? Nothing is ever that simple, right? So, a downfall of the Canada Health Act is that it only deals with the financial side of healthcare. It doesn't talk about the organization or the delivery of care. And we all know that those two things go hand in hand because resources cost money. Also, the Canada Health Act is not legally binding. This means that you are not obligated to participate in the Act. And then, if a province or territory does choose to participate, there's little more than a slap on the wrist for not participating properly. There is zero accountability and responsibility for your government to stick to these criteria. However, a major pro is that the Canada Health Act provides an excellent set of guidelines for the fair distribution of healthcare funds and therefore resources in Canada. So why does this matter to you? I mean, most of us here, we're all students, right? I'm broke, you're broke, we go to practicum, we work for free, and we go to the classroom and we bust our butts in class. So why should it matter? It matters because nursing is political. Whether we choose to internalize this concept or not, nursing is political even at the student level. Who we choose to vote for and support directly affects our daily practice. So what else can we do other than vote? We can increase our critical thinking when key phrases pop up in the media. Things like increased choice and increased access. Well, what do these phrases actually mean? Who enjoys this choice and access? And how much is this going to cost the average Canadian? These are important questions to ask because the economy is in such an awful state right now. And we're also always hearing, and we will hear in the next presentation, about how the two-tiered system is going to reduce our wait times. I'm curious what their plan is for this. How are they going to achieve this, and what is it going to cost? Is it going to be at the cost of our precious nurses and doctors leaving the public system to work in a private one? We also hear some sneaky phrases that can confuse us because we don't really know exactly what they mean. Things like P3 and 3P, even double P, triple P, or public-private partnership. Can public healthcare and private healthcare actually partner together successfully and harmoniously? I personally don't think so. However, that being said, it is important to form your own opinions based on fact, ask your questions, and be willing to wonder. Never lose your curiosity of things that you hear in the media. We can also become advocates in our community. We can engage our community in health prevention and promotion. This is ultimately cheaper for our system and will relieve the stress on our precious acute care beds. Our healthcare system needs to become much more far-reaching than it currently is. As student nurses, we need to reach beyond our hospital walls and into the homes of our seniors, all the way to the streets, to our most forgotten people. Our system needs to focus just as much on wellness as it does sickness, because sickness is expensive and it takes away the ever so valuable quality of life of our patients. So in conclusion, this presentation is about challenge and opportunity. I'm not trying to say that it would not be a giant challenge to repair Medicare to what it used to be. Sometimes the task at hand can seem so large that you're not sure where to start, even if you're in support of it. But what I'm trying to get at here is that we, the next generation of nurses, have the opportunity to make sure that the hard work that the founders of Medicare did in the past will not go to waste. So if you believe that with every challenge there breeds an opportunity, then engage your community and become an advocate for public health care. Get active and get involved, and be the change that you want to see in the world. I'd like to ask everyone to take a moment just to look at the people beside them. Memorize these faces. These faces are important because these are your partners in saving the healthcare system. Because divided we will fall, but united we will stand up for Medicare. Thank you for your time. Enjoy the rest of the